In other news today, stricter testing requirements for travelers, along with an extensive travel ban, go into effect across the country today. President Joe Biden's administration is hoping those protocols will slow the spread of the new COVID-19 variants here in our country. Joined now live by NBC News senior medical correspondent, Dr. John Torres. And he told us yesterday about COVID-19 hospitalizations declining in the U.S., and yet Biden seems to not be taking any chances on this. What do we know now about these variants of the virus, Doctor?
The main thing we know about these variants is there's three right now that we're concerned with. One is the UK variant. It's been around since around September in the UK, but it's also been here in the United States, and now it's in around 22 different states. And so travel bans really aren't going to work for the UK variant, and they're mostly targeting the South African and the Brazilian variants, which are ones that are also more contagious and possibly more dangerous. And so those are the ones that they're concerned with, and that's why they're doing these travel bans. Now, the South African variant has not been detected in the US yet, but unfortunately the Brazilian variant, one person in Minnesota this week was detected with that. They had traveled to Brazil and back. Luckily, nothing spread throughout the community other than that, but they need to keep an eye on that. That's going to be very important going forward.
And we mentioned the travel restrictions, which would prohibit travelers from dozens of countries, but should we stop any of our everyday activities here in our country while these variants are out here in the circulation?
No, we shouldn't stop the day activities we do, the normal things we're doing, but with the understanding that if you have certain restrictions in your area because of coronavirus or COVID cases, then you need to follow those. The most important thing to remember is with these variants, obviously the vaccine's important, but so too are those measures we take. Wearing a mask, social distancing, washing our hands, they work against keeping these variants under control and preventing us from getting sick with them. And that's the important thing we can do, not just for ourselves, but our community. And so now is a good time to double down on those efforts, Robert.
And very quickly, there's talk out there about double masking. What's your advice on that?
You know, it's more quality than quantity. So if you have a mask that has 2 or 3 layers and they're thick enough layers where, you know, if you hold it up to the light and you can't see the light through it, that's probably a sufficient mask. If you can see light shining through it, then you might want to double up in those cases.
All right, Dr. John Torres, thanks very much for joining us here on KXAN. We appreciate it.